Meanwhile, the month of May is recognized as Stroke Awareness Month. According to the American Stroke Association, it is the fifth leading cause of death and a leading cause of disability in the U.S. 1 in 4 people will experience a stroke in their lifetime. Although it is frightening, knowing the signs of a stroke and getting immediate treatment can help save lives. This morning, we're very lucky to have Dr. Stephen Warach here from Ascension Seton. Doctor, thank you so much for joining us to talk about this topic.
Well, thank you for talking about it.
Yeah, we did mention there that, again, May is Stroke Awareness Month. So just remind us what exactly a stroke is.
A stroke occurs when a blood vessel is disrupted in the brain. It can either be a broken or burst blood vessel, or more commonly, it's an occluded blood vessel. A clot forms somewhere else in the body, occludes the artery, deprives the region of the brain of blood, oxygen, other nutrients that it needs, and brain cells die, and a person develops symptoms related to that brain region.
And I think it's obviously important to let people know about what are some of the signs they can look out for if they or someone they know is going to suffer from a stroke. So what are those?
And that's really the most important message we want to get out during Stroke Awareness Month, because if you can recognize the signs in yourself or someone else, it could be life-saving. And the hallmark of a stroke is the suddenness of a change in function. And if there's a sudden change that lasts for more than a few minutes, you should call 911 and get to a hospital as quickly as possible. Now and this is derived from the American Heart Association, use the acronym FAST, F-A-S-T, to help remember what stroke symptoms are like. The F stands for facial weakness, and that can be a drooping of a face or a clear asymmetry of the smile that wasn't there before. A stands for arm weakness, and the way you look at that is you ask the person to hold their arm up, and maybe they can't do one, or they can do it and it drifts down. Well, that's evidence of arm weakness. The S is a speech disturbance. Sudden onset of slurry speech, garbled speech, inability to understand speech. And that's the S. T is it's time to call 911, because time is critical. The therapies that we do have are much more effective the earlier we can initiate them.
All right, Dr. Stephen Warach, thank you so much for joining us, especially highlighting those signs to watch out for. We really appreciate that, and hopefully that'll help people out there.
Thank you very much.